Pharmacology of the thyroid and anti-thyroid medications. So firstly, thyroid preparations are basically synthetic hormones which we give to hypothyroid patients. And those include levothyroxine, which is your T4, and liothyronine, which is T3. For anti-thyroid agents, our main class of drugs will be thionamides, so things like metimazole as well as propylthiouracil. Their mechanism of action is inhibition of thyroid peroxidase enzyme that blocks organification of the iodine and subsequently prevents its attachment to the thyroid globulin molecules. And PTU has an additional mechanism of action as it also inhibits 5' deiodinase enzyme, which is required for peripheral conversion of the T4 into active T3. Classic side effect of these drugs is agranulocytosis, also known as neutropenia, which can increase the risk of bacterial infection in these patients. And they can also get a very non-specific drug-induced rash. Now, additionally, metimazole is a very teratogenic drug, so we have to avoid it in the first trimester of pregnancy if the mother has any hyperthyroid disease, and use the PTU instead. However, because propylthiouracil is very hepatotoxic, we have to switch back to metimazole from the second trimester onwards. Another class of medications are iodines themselves. So I want you to remember that normal levels of the iodine stimulate production of the thyroid hormone. However, very high levels of the iodine inhibit the T3 and T4 formation, and that is known as a Wolff-Chaikoff effect. There's also a monoclonal antibody known as teprotumumab, which is directed against TSH and IGF-1 receptors in the orbital fibrocytes, and can be used specifically directed at the Graves' ophthalmopathy. And lastly, radioactive iodine works by destroying the thyroid cells once taken up by the gland. It's generally safe to use, but remember to avoid it in pregnant women because radioactive iodine can cross the placenta and destroy the fetal thyroid gland as well. I hope this helps, and follow ConceptRx.